and I'm here to inform you on a physical disorder called Tourette syndrome. Tourette's affects the central nervous system of the body. This system includes the brain, spinal cord, and many neurons, and its function is to send, receive, and interpret information from all parts of the body. Tourette's is a genetic disorder, but its physical cause within the body is not definite. Doctors and scientists don't know anything for certain, but some research points to a problem with how nerves communicate in the brain. Neurotransmitters, which are chemicals in the brain that carry nerve signals from cell to cell, may play a role. Tourette's is characterized by uncontrollable movements and sounds. Symptoms include tics, which are sudden, repetitive, non-rhythmic motor movements, and vocalizations, including discrete muscle groups.
There are two categories of tics. Simple tics include head jerking, finger jerking, throat clearing, eye blinking, eye darting, and barking. And complex tics include touching nose,
Summarize the book.
repeating words,
Yeah. The boy and the dog climbed over the fence, and they went to the forest.
smelling objects, and swearing.
Further information or any questions, you can call the Tourette's Association of America at 718-224-2999 or at tsa-usa.org. It's frustrating when your body does something you don't want it to.
Hello, Dr. Anna here. I am a specialist in a disorder called epilepsy. Did you know that about 1 in 26 people develop a seizure disorder in the United States in their lifetime? Epilepsy is a neurological disorder that affects the central nervous system where the nerve cell activity in the brain becomes disrupted. It causes patterns of seizures, brain damage it could cause, acts of unusual behavior, loss of consciousness, etc. There are many different symptoms which we will show. Seizures can result in people getting brain tumors, head injuries, lead poisoning, maldevelopment in the brain, and genetic and infectious illnesses. Jill, so I hear that you have come to see me for drug therapy because that's what you have to do. Go to your doctor first and ask them what you should do with medicine. With epilepsy. Okay. Now, most treatments are controlled by drug therapy, and it depends on how severe your seizures are, your overall health, how old you are, your medical history, and how often your seizures happen. Now, are they repeated leg seizures?
Yeah, very well.
Then that is definitely epilepsy. One option that you have is anti-epileptic medication, but it has some side effects to it. Fatigue, which causes you to be tired. You'll get very dizzy. Well, you can get a lot of weight added onto you. You can break out in skin rashes, loss of bone density, loss of coordination, and you could also have speech and memory problems. Also, surgery is another option for you. It is done when tests show that your seizures are in a small part of the brain and it does not interfere with your vital functions. If seizures originate in a part of the brain that cannot be reached, they could also cut indents into your head or into the brain that can stop the seizures from spreading to other places. So you have many options, but many contain side effects. But they will all eventually hopefully help.
Some people will stare or blink rapidly, and others could twitch their arms or legs.
For anybody that you know is suffering from epilepsy disorder and they don't know what to do, log on to www.epilepsy.com and that will definitely help you out.